long does it take after you eat that bite of whatever you're snacking on to change your risk for COVID complications? 30 minutes. That's it. That's what we're going to be talking about today. I'm Dr. Daria. I'm an ER doctor on the front lines taking care of COVID patients. I'm a mom of 2, and you know me. I take the very best information in science to help make your life healthier, better, and easier. And today I wanted to talk to you about diet and why it matters, because this is our new FORTIFY series, and it's all about things that you can do today to fortify your immune system, fortify your health, to give yourself the greatest strength against COVID or any other disease you might encounter. Today I wanted to talk about diet and especially give you a couple of hacks when you're having that craving coming on. But before we dive in, I want you to understand why, because I know that so many of you really like knowing the science. So really quickly, just gonna dive in here. What happens in your body after you eat that meal? Say you have a meal that's a lot of processed sugar, processed foods, a lot of saturated fat. What happens? Within about 30 minutes, the lining of your blood vessels starts to change and it starts to contract. Your body also starts to release cytokines, which are those inflammatory markers that you've probably heard about, cytokine storm happening in very severe COVID cases. And also one other thing, your body starts to change the function of ACE2. Now, ACE2 is probably that receptor that you had never heard of and never cared about up until 4 months ago, and now you hear about it all the time. Why? ACE2 is the receptor that COVID uses to gain access to our body's cells. And ACE2 also has a lot of other really important functions, including regulating some systems, including our blood pressure, including regulating COVID complications with blood vessels and our lungs, and more of that cytokine storm and acute lung injury. So it really matters what you eat within 30 minutes. Now, the good thing is that the reverse is also true. So if you're eating a meal that has a lot of whole foods and is much healthier, you're going to be eating something that's very anti-inflammatory and within 30 minutes can also reduce your risk of COVID complications. So let's get into what those are. Now there's lots of ways, I promised you some hacks, but there are also many ways that we can eat a much healthier diet. So just broadly, really quickly, that includes a lot of whole foods, produce, high fiber, good protein, healthier fats. Those are all things that we can be doing. I will do other videos on them. I have done other videos on them, but today I promised you some hacks because eating a healthy diet includes eating much less processed foods. And I know that many of you at home right now, you're watching those Instagram pictures. You've seen those pictures of breads and pretzels and you are having carb cravings. So this is one of the first steps. I wanted to give you some hacks to help you with those cravings. First step is to start paying attention to your triggers. We all have our own triggers. Maybe it's a specific time of day or some way you're feeling that starts to trigger you to want carbs or some processed food. Pay attention to that because you can start to circumvent it by changing the triggers or changing where you are when those triggers happen. Now say that carb craving has hit you. I want you to commit. Everybody watching, I want you to commit. I want you to put in the comment section right now if you're gonna commit that when that carb craving comes on, you are going to try one of the following things. First step is you can just drink 12 ounces of water, but while you're doing it, make sure that you're just taking a breath, having a moment for yourself while you do it, not looking at your phone or anything else, just taking a moment. Option 2 is to drink a cup of green tea. This is something I do, say at 2 p.m. in the afternoon when I'm starting to feel a little bit drained and I maybe want that sugary snack. I have a cup of green tea. It's kind of my way of saying I'm shutting down this craving, and it makes a huge difference. Third option is you can just eat a good serving of protein. Think a hard-boiled egg or a grilled chicken or even some string cheese if you don't have any other options. And option 4 is to go for a 10-minute walk or a 10-minute exercise or activity. Try any number of those things. I have some patients who have said that sometimes they had to try 1, 2, or 3 things to be able to end that craving, but that they did and it worked. And of course, studies show that even if you do give into a craving after you've done one of those things, you will eat less of that food. So there you go. Just by stopping that one craving, you're going to decrease your body's inflammation. You're going to better regulate those cytokines, that ACE2 receptor, and all those things that you're hearing about that, bottom line, serve to fortify your immune system, fortify your health today against COVID and anything else. We do not need to wait to start lowering our risk for COVID today. Please share this with other people who need to have this information because it's so important that all of us lower our risk for COVID in so many ways that are right at our fingertips. And let me know, what are your questions? What comments do you have? What ideas did this spark? what you want to share with me. You know I love to hear your information. I'd love to hear your comments because I am here, again, to take the very best information to make your life healthier, better, and easier. I'm Dr. Daria. Stay well, and I'll talk to you next time.